Welcome to Nexus Medical Media. In this video, we are going to talk about the history taking of a patient with diabetic foot ulcer, right? So this patient presents with an ulcer. However, this is very important. As you see a patient coming in, don't conclude that this is a diabetic foot and you just focus on a diabetic foot. Other causes could also be responsible, right? Because we have different types of ulcers. So you need to go through all those. Malignancy just being one example, acute limb ischemia. These are the things that could actually happen, right? So you just make sure you include everything in your history. In this video, I'm just going to tell you the pointers that you need to include if we're talking about a patient with diabetic foot ulcer. All right. So in your history of presenting complaint, you need to mention that this is a patient with a background of diabetes mellitus. If it's type 2, you have to mention that this is type 2. And for how long? If it's for 10 years, just mention it. It's 10 years. If the patient has hypertension, you have to mention that as well, and duration. Who now presents with an ulcer, right? So there is a video. If you click on the top right corner, there is a link to a video. We talked about the 6 questions you need to ask a patient with an ulcer. So the same format, you have to ask about the duration. So when was it first noticed? The first symptom, what brought it to the patient's attention? I remember some time back, I had a patient who was sitting near the fire, and it started bleeding without any pain, and someone who was sitting across the room saw that this patient was bleeding. That was the first symptom. What other symptoms are there? How has it changed since it was first noticed, this ulcer? Is it now discharging something? Is it changing in shape? How about the size? We also need to talk about multiplicity, right? Does the patient have other ulcers? If the patient had ulcers on the other leg, you need to talk about that as well. If they've healed, you have to mention that. And also you have to ask, what does the patient think caused the ulcer, right? So I expanded this in the video that is again in the description of this video. So you have to watch that video. It's very important, right? So as you proceed, right, so you have mentioned that the patient has diabetes, type what? Hypertension, who now presents with an ulcer, and you have described according to this format. Now you have to mention the risk factors to get an ulcer, right? So trauma, infections like TB, syphilis, and also malignancies, skin malignancies. You need to mention vascular diseases, risk factors like smoking, and you have to express this in peak years. If there is hyperlipidemia known to this patient, you have to mention that as well. So these are all risk factors. These are risk factors for ulceration and risk factors for vascular diseases. Next, you have to demonstrate the control of blood glucose. Symptoms of hypo or hyperglycemia, both of those can actually happen in a diabetic patient, right? You need to be able to evaluate or to ask the symptoms of hyperglycemia, those polyuria, polydipsia, polyphagia, and if the signs of hypoglycemia, you see there is this classification, we call it autonomic and neuroglycopenic. You need to go through that, right? And then there are micro and macrovascular complications of diabetes. So these 2 points, the blood glucose control of the patient and the presence of micro and macrovascular complications, these are best. I think it's best if you put this in your systems review, right? So from your general, you have to mention, if you talk about weight loss, If you talk about fever, because this patient is in ulcer, it could be infected, right? In the central nervous system, you have to go through, strokes, transient ischemic attacks. You talk about headache, and then there's eye disease, right? So in eye disease, you have to be very specific. The four ways where someone who is diabetic will have visual disturbances. The first one is a cataract. Second is retinopathy, which it takes time. It doesn't just happen like in 2 days. And then next is like the hyperglycemia. Let's say in the morning or after eating, this patient will have like visual disturbance, but as the time went by, then it will just clear out. Those are just waves of hyperglycemia. And number 4 is glaucoma, right? So there's that. And then if you talk about the CVS in chest, we are talking about angina pectoris, transient myocardial infarction, chest pain, etc. Talk about the GIT, your nausea, vomiting, postprandial abdominal pain. If you think of mesenteric ischemia, this is very important. In the genitourinary tract, you have to go through everything that we talk about in the GUT. However, it's also important to think of urinary tract infections in a diabetic patient, and in the musculoskeletal system, and other. I did not put everything here, so you have to make sure that the micro and macrovascular complications, you've put them in their rightful place, and also just find a way to put the to demonstrate if the this diabetes is well controlled or not. In the past medical and surgical history, there is something we call THREAD, right? It means TB, hypertension, rheumatic diseases, epilepsy, asthma, diabetes. Please don't put like death, just put THREAD. It's, a patient could look into your nose and see death. Not cool, right? So we have mentioned that this patient has diabetes and hypertension. So you need to go through the medications that the patient is taking and doses. If there has been changes, you need to mention that. If there has been, you also need to know if the patient is actually taking that medication, right? So it's very important. Then in surgeries, the past surgeries, amputations are of great importance. You need to know if the patient has had amputations before. Then in the family history of diabetes, history of early deaths in the family, history of skin malignancies is just an example. Remember, I told you that you have to think of other causes of ulceration. And the social history, you have to go through everything. There is smoking, there is alcohol. That is if the patient is not smoking. But if this patient is smoking, we have to put that risk factor in the HPC. You have to promote it, right? And also family support. You need to know if there is proper family support. For example, because the worst case scenario, someone with diabetic foot could actually lead to an amputation. So you need to know the family support this patient is going to have. You need to know finances. You need to know if the patient is on medical aid, because this patient, let's say he was the breadwinner, is the father of the family, supposed to provide for everyone, and then suddenly we are just amputating, and you lose a job. After that, you have to examine the patient before you think of examining the foot. After examining the patient, whole general examination, then you don't go to the ulcer as I have put here. You have to go to a supposedly normal foot. You examine that, and then you go to the one with the ulcer, and then you examine it. We are going to talk about examination of an ulcer later, right? So for now, this is how you take a history of a patient with a diabetic foot ulcer. I hope you enjoyed this video. I hope this was useful. If so, please make sure you subscribe, give it a thumbs up, and share with your friends. Until next time.